6 p.m., and I'd like to bring the meeting of the Board of Health to order. Before we get to the agenda, I'd like to welcome a new member of our team, Amanda Hicks. Thank you for joining our team, Amanda.
Thank you. Also, Mr. Chairman, I need to recuse myself from the first appointment on the list.
Yes, yes, okay, we understand. I'd just like to say, I'd just like to ask you a couple questions.
Sure.
Nothing difficult. Just wondering why you chose to be on the Board of Health.
The reason why I did was basically because it fit what my expertise the most. I have worked in past in the restaurant industry, and I am currently I work at GBI. We also do the septics, and I look at different plans. So I was trying to pick a board that I could, fit my aspect the most. And then the spot in the Board of Health came up. So I went for it.
Great. That's great. We need some young blood on this board.
Yes, new perspective.
Okay. Anybody else would like to add to that? Okay. Well, we certainly welcome you to the board. You're welcome. So we'll go to the agenda here. And Karen, first on the agenda, we have, let me put my glasses on, I'm sorry. We have 10 Birch Hill Road and Karen Hegan.
Yep. Good evening. My name is Karen Keegan. I'm from Guaranteed Builders. I'm representing 10 Birch Hill Road this evening. It is a septic system that needs an upgrade. Right now there is a dry well existing and a cesspool existing. We'll be combining those two into the septic tank and then into the leach fields. Right now it's a 2-bedroom house. We're proposing to upgrade the system to a 3-bedroom system. The system will be located in the back left-hand side of the lot. There's a proposed septic tank and a proposed pump tank because it is high groundwater in that area. And I know that you should all be familiar with that area and the high groundwater and the septic systems out there that are also close together to the wells. Yes. So of course I have a butters wells that I am close to, but far enough away, more than 50 feet to I am 76.4 feet away from their well, and to the butter on my right I am 76.9 feet away from the septic tank, which is the closest component to that particular butter.
Right, I see that.
My own well, which is located in the front left corner of the property, I am 67.6 feet from. It's a lawned area in the back. The butter in the back is a proposed solar farm. So I will not have any wells or other septic systems in the back to have to deal with. Okay. The system is designed with a 25% reduction to it because of the size of the backyard and what I have for structures in my that are near my proposed system. Sure. I have an existing deck that is very close to where my system is going to be. I also have a large oak tree. As you can see, it has a benchmark set in it. That tree is at least a good 20 to 25 inch tree. It's a good sized tree.
Excuse me, where's the tree located? I'm sorry, I don't see it on the plan.
Right to the left of the deck.
Oh, I see it now, yes. Okay.
Yes. I don't want to get too close to it. I mean, as it is, I'm close enough to it.
Sure.
But it's a good sized tree. I mean, it's not humongous, but it's at least I would say a good 20, maybe 18 to 20 inch tree.
Sure.
So
I noticed that there's an existing well. It's a non-potable.
Non-potable, not connected to the house at all.
Is it being used for anything?
Nothing.
Nothing.
In fact, the tenant didn't even know that there was a well there. He didn't know what was under the cover.
Is it a shallow well? It must be a shallow well, correct?
Must be a shallow well.
Okay.
Yes. Okay. And I'm more than 50 feet away from that in case there is an issue with that.
Okay. Now the well to the bottom left-hand corner is that the abutters well, or is that?
The abutters well, yes, which is off the property, the far left
Off the
one.
property, yeah. And
Yes.
it's 76 .4
4 feet from the
feet.
well, yes.
from the, okay,
Yep.
yeah. Now, there's an additional, there's another well, isn't there?
The other well is on the right-hand abutters property,
Okay, I see it, yeah.
and that's 676.9 feet away also.
76.9,
From
yes.
the component, that's just from the component. It's even
Right,
further
right.
from the,
Right. I know that it's very narrow in that area. There's very
Yes.
little space. I
yes,
understand. And I noticed you have a macerating pump in the chamber and
in the pump tank, yes,
in the pump tank, yeah.
yes.
So that's 2-inch going to the leach field, correct?
Yep,
2-inch line going to the leach field?
Yeah.
Okay. So being a macerating pump too, it's, you know, it does grind it down to a liquid
yes.
form. Okay.
So we've kept the 4-foot offset to groundwater to conform.
Uh-huh.
So we're not asking for that. We're
Okay.
definitely here for the offset to the wells, the existing wells, including our own.
Right.
The 25% reduction.
Right. I did speak with Steve today,
Okay.
Steve Donatelli, and he feels comfortable with everything. And I certainly feel comfortable with Steve. So, does anybody else have anything to add here? I know it's difficult for everybody else because they don't have this. I have a real set of plans here. How are you doing there, Corey?
Yeah, I can zoom in and I can look at those pretty well.
Oh, you can. Okay. Everybody else? Can we
I
see?
do have a question, Bob.
Yeah.
Under the wording edge of pavement, which is near the bottom left corner of the drawing, it has a note that says, I certify that something June 21st, 2011.
Yes, that's the soil evaluator certification.
Is
So
there
the
is there a time constraint on the expiration of that test?
No. I mean, she has to take schooling on a yearly basis for that, but no, the certification is good as long as she takes her schooling.
Okay, thank you.
Any other questions?
No, this looks like an upgrade in system. And, you know, these properties out there don't have a lot of room to work with, so.
No, there isn't. And, you know, it looks like it's a good system. I feel comfortable, especially with Steve's okay.
Yeah.
And, does anybody want to make a motion?
I do. Motion to accept.
You have a motion to accept?
And I'll second that, Bob.
Okay, but can you be a little more specific?
Yeah. I'll make a motion that we accept the variances for the wait, what?
25 feet, yeah.
Yeah, I couldn't find it on my.
25% reduction in leaching area, correct?
Yep, so moved.
And the upgrade from a 2-bedroom to a 3-bedroom, so there's
Oh, the upgrade from a 2-bedroom to a 3-bedroom, right?
Yep, and the offsets,
Something else, right?
the offsets to the wells.
Oh, yeah, the offsets to the well, the location setback from private water supply wells, yes. Okay, so that's the motion, Corey?
Yeah, I mean, there's nothing else we can do, right? Yeah.
Okay, can you sound it out again, please?
I can try. I can't find on this thing where all those variances are.
Okay, it's on the very corner.
They're on the right-hand side of the plan, on the side of the
Right on
plan.
the right-hand side.
Yeah, that's where I am. It's just so small on my phone. That's the
So
problem.
it's for the 2-bedroom to a 3-bedroom
Okay,
upgrade.
here we go. Yep. All right. So yeah, I'll make a motion that we accept the plans for the 2 to 3 bedroom upgrade and the 25% reduction or the offset to the wells. Was that it? Offset to the wells?
That's it. Yep, that's it.
All right.
That's it.
For Birch Hill Road property.
10 Birch Hill Road.
Okay, all
Sorry.
in favor?
Aye.
Aye.
Okay. I guess that passed, the motion is passed.
Yeah, sorry, that was a little cumbersome. I couldn't find
That's
it
okay.
on my phone here, and then I couldn't find the number of Birch Hill Road. Birch Hill Road.
It's 10.
Okay,
Yeah.
we did get 2 ayes, correct?
Aye.
Okay,
Aye.
okay,
Yep, I
that's
said
okay.
aye.
The motion passes then.
Okay, I thank you very much.
You're welcome.
Have a great evening.
You too.
Oh, thank you. Can we do this next meeting in person or what?
I'm sorry, I would like to do it in person, yeah.
I mean, we can use the big meeting room. We don't have to meet in the little Board of Health office. We can use that big meeting room the selectmen use, you know?
Right, spread out a little bit, yeah.
Yeah, it's just, boy, that would,
That would be my preference, but
this is starting to get old, you know?
okay,
Especially
so
if we're
we
doing
move.
good. If Douglas is doing good, I mean, we'll find out once we get our report. But if Douglas is still,
Right.
doing pretty good, then I assume we can go there and be 6 feet apart or something and have our meetings.
Sure. Okay, Tom, we're heading in your direction. Next on the agenda, we have Breezy Picnic Grounds and just general discussion.
Emily, you want to lead?
Sure. I didn't know we were going to be talking about this. I wasn't at the meeting that they had. Rich did tell me it was just kind of like a hearing and that there hasn't been a decision made yet. So there's actually no definite word yet.
Okay, so Rich, at this point, he has filed in Superior Court, is that correct?
I'm not sure.
You're not sure?
They close for the season in just a matter of a couple of weeks, don't they?
Yeah, I think so.
Labor Day, not even weeks. So
Okay, so this week.
See, the last,
It's dragged out so long now anyways. It's
Right.
like,
right. Tom, if you don't mind, I spoke with Keith about, I would say, 3 to 4 weeks ago. He told me at that time that they would be only open for 2 more weeks. Obviously, that wasn't the case.
I believe it's always been Tuesday is the last day.
I guess, but that's not the indication that he gave me.
I think he was just telling you what you wanted to hear, Bob.
I think so.
I don't think there's been any variance on the Labor Day, at least on my end. I don't think there's been any variance on the Labor Day being last day. And
Yeah.
No, we're actually.
Well, I just wanted to make mention of that because, it just seems like we're trying to work with someone and we're hoping that they're working with us as well.
Yeah.
Yeah, so especially in the future, Tom, when we're dealing with, I understand that it's so difficult to be a small business and especially under these circumstances. I totally understand. But, it would be nice if you could discuss these issues, as we should, and be honest about it. And I felt like, he was just scamming me.
So I can't comment on anything that
Sure.
I wasn't aware of, but I know in all my filings, all my written filings, I thought it was pretty explicit on the Labor Day. So I'm sorry if there was something
Sure.
there was some cross wires. But
yeah,
I don't.
Go ahead. I'm sorry.
No. Sorry about that.
No.
So to my understanding, Labor Day is the last day, and hopefully, I will say on my end, hopefully COVID-19 is not a thing, and hopefully this is the last time that I'm before this board. I'll say that.
Right. Well, I just wanted to make mention of that. To me, that's important. I don't know how the rest of us feel, but
Glad it wasn't Ebola.
Yeah. You have to have a little respect for people in general. And even if you're running a business like that, we have businesses in town that have adapted to the situation, and they've adapted well. They've tried to work with us, and they did so in the proper way. I felt that the way we had to deal with this operation was just impossible. Every inch of the way. So it really got to the point where we just couldn't believe anything that he said. So sorry to hear. I'm sorry to say that, Tom. You're a gentleman. I know that you understand too, but and you're also representing him. So I understand that too. But do you have any questions, Tom, or anything that you'd like to add to that?
No questions on my end. I can just generally say
Sure.
I think there was any intent behind anything.
Okay.
I can't speak to any conversations I wasn't a part of.
Sure.
Certainly, in all my dealings, I've found there haven't been any intent to deceive about what's going on, and I appreciate everyone trying to work this together. But if there's no specific questions on our end, I don't have any questions on my end for the board.
No, it seems to be that's unless anybody else has anything to say.
Yeah, Bob.
Yes, Dick.
I have two questions.
Go ahead.
One is for Tom and Emily. Has the owner of Breezy Acres done anything to deal with the lack of social distancing at the entrance to the park?
Maybe Emily? I don't know.
It's hard to say because sometimes when I've been recently, there really hasn't been too many people at the park because we've had some. I didn't go this past weekend. It wasn't like super great weather. You know what I mean? Like a lot of times it hasn't been great, so I haven't seen too many people there. I know when me and Bob went recently, they were having people, at least like in the line for the slide, they had employees spacing people out.
Yeah, my concern is at the entrance to the park where they're really jammed together.
Yeah, I know. And for that part, I don't think so.
Right. And the second and last question for Agnieszka. Can we trace any cases to the Breezy Acres?
No, as far as I know, I don't have any cases related to that park. Although I was driving by a couple days ago and I saw people being close distance, no masks, was end of last week, which really concerned me.
Right.
Hopefully we won't get any cases, but I feel like the risk was pretty high there.
We are very lucky then because this has been going since the beginning. Crowds at the entrance, no masks, no social distance.
Agnieszka, would you know like if somebody had COVID but they weren't from Douglas? Because I think there's a lot of non-residents who are going there.
Huge amount.
Other town share the case with me.
Okay.
Places, like it's a cluster and they will share the case with me, yes.
Yep.
But there are also people that are coming from out of state and they're coming from places as far as, northern New England and southern New England. So up and down the coast,
Right.
So even if they do, if they are positive, then how would we know?
Right. Those people are going so many different places.
How would we know that it was from there? Right. Tom, would you like to add anything to that?
So my 2 points. One would, I think that's fantastic news to hear that there's been no cases that have been traced or linked in any way to Breezy. I think that's a good thing, not just for us individually, but obviously for the town and hopefully for the community as a whole. I think that's a positive statement. So I just think that just kind of note that, and then secondarily to the point of social distancing, to my understanding, based on pictures I've seen and based on my analysis of reviews that customers have submitted, it seems as though people are commending the business for implementing certain distancing procedures. I know to some extent there was some discussion early on of areas for improvement. My understanding is those areas have been improved, or so I think that there have been procedures implemented, is my understanding. So that my understanding that everyone has been distanced out in accordance with protocols, and to some extent even in excess of the minimum 6 feet requirements. So that's what I've seen. That's what I've seen based on pictures. I have not done a walkthrough of the park contemporaneously. Obviously, without a 24 monitoring there, I can't. I'm just basing it off of what I'm hearing here. So my understanding is it's been improving. Hopefully, those procedures remain in effect for the limited days that we've got open, and we continue to have the same report of no linked cases to Breezy.
Anybody else?
I don't think there's really anything else to be said. I mean, they kind of do what they want. So until like court tells them they can't, I guess, and somebody comes by with a chain, they're going to stay open anyways. And they've only got like a week left. So at this point in the game,
at this point,
fingers crossed. I guess we got lucky that it wasn't, that COVID wasn't that contagious, and only, I don't know.
Because I know that I know that the numbers are going up as students are going back to school because of the parties, so on and so forth. And, social gatherings can be a result of, the epidemic can be a result of social gatherings. So that was our main concern too. I mean, let's face it, the health and welfare of people and people in our town.
I think we got a little bit lucky, and it turned out COVID wasn't quite as bad as they thought it was going to be, and I guess all those things worked in our favor. Right. Hopefully.
Okay, Tom, do you have anything else?
Better at it,
No,
are you all set?
Nothing else from my end, but if anything else comes up, where to contact me. So thank you.
Okay, thank you for coming. Okay, so that takes care of number 2 on the agenda. So what did I do with my glasses?
Number 3 is COVID-19 update.
Okay, yeah, COVID-19 update. That's 3rd on the agenda. And Agnieszka?
Yes.
It's up to you.
From March. So we have 3 active cases now. We had
2 cases. Oh,
great. I released 1 person today from isolation. So I feel like it's a little bit up. So I won't be surprised if our color on the map will change.
Mm-hmm.
It's nothing like alarming, but I noticed, the numbers are a little bit higher.
So Agnieszka, with school starting back up, I assume anybody in a house would have to be quarantined too. Any kids that live in a house wouldn't be going to school. I mean, I assume that once school goes, we'll probably see a rise anyways in cases.
The risk is higher for sure.
Once that starts up. I mean, I know I'm back at work too, so we wear masks everywhere and tend to stay pretty far away from each other. But once kids get back, I mean, they'll have to wear masks too, and we'll all still be pretty far away. But I'd imagine my work as well will start to, we'll see some increases. But the kids are part of that quarantine or that isolation too, even if they.
Yes, when they, when they are infected or when they are close to the positive case, they have to be staying home.
I mean, as long as people who are testing or exposed are being careful and are smart about it, I mean, we should be okay anyways through it. But.
Although I had couple last cases were very young people. I had 25 years old, 22, and 18.
Really?
So this is something new.
Were sick with it? Otherwise?
Yes, confirmed cases.
Wow. How long would they sit? Like really sick? How long would they sit for?
No, Tested positive, some flu-like symptoms, nothing serious, no
All right, that's good.
They were able to stay home, but I noticed the age, like I see younger people.
Yeah.
Testing positive now. Before were people like
How
in their 40s.
how about these two cases now? Are they more serious or?
Everybody's able to stay home, and mostly like one person thought she had a allergy because was congestion and like stuffy nose, little cough, until she started to, she got fever.
I see. Okay.
Went and got tested and she tested positive. So like mild cold.
Okay.
Comes with fever, like cold-like symptoms.
Did they go to Breezy?
Maybe I should ask next time. Specific. Maybe I should add that to the questionnaire.
Okay. Amanda, would you like to add to that? Or ask any questions, maybe. I don't know.
Yeah. So has like I'm trying to listen and collect what I've missed so far from everything going on.
Well, you actually got in at the right time.
So I guess my question would be, has Douglas been one of the better towns with everything going on? I mean, I know that I've been to the restaurants in town. I know they're following the protocols and stuff like that. So just jumping in right now, I'm just hearing like 2. So I don't know if that is a lot of new cases for such a small town, or if it is, like she said, she thinks it's going to be climbing up, which I do agree with. Going back to school, people going back to work and stuff like that, we may see more cases. So I just don't know if that's a significant number or if it's okay at this time.
There was none for several weeks, or like one every 3 weeks.
Okay.
Like in one.
How did we do as a town overall, Agnieszka?
We are doing good. Like we still white on the Massachusetts map, like the state government map.
Yep.
Yeah.
Good. We are not as bad as Saturn is on red. Saturn has so many cases.
Yes, I did hear about that. Yes.
What really is us is like we have no nursing homes. We have no like sometimes people, or like community housing, like many elderly housing. This is when many people see the cases.
Yes.
You know what population Sutton's, increase is affecting? No.
I have no idea. I know they had some bunch of kids attending some parties in Millbrook, I heard, and a bunch of them got tested positive. So it could be because, really they go by the number by like compared to like 100, I think.
100,000.
Something like this, the ratio. So it was, so it was a little bit higher. But I heard there was like some issue with young kids, high school kids in Sutton after some party in Millbrook.
Okay.
It could be this or something else. I'm not fully.
Sure. Right.
I know there was a case in Milford there where I don't know if there's any. I don't think there's any COVID attached to it yet, but you see that on the news. 200 people at a party or something. The house got fined like $1,500 or something.
Yeah. Well, that's going to happen. It's going to happen. So.
Yeah, you just hope for the best.
You teach in Milford, so that's not very good.
No, I didn't like hearing that.
No.
But
anything else on COVID-19?
So just to add, I'm working closely with the schools, with the principals and superintendents.
Good, yeah.
Every other day from the nurses, and so I'm on a board with them. They send me a bunch of their plans for review. I really like the new superintendent. Like
good cooperation with the school.
Wonderful. You know, he's
Okay.
really nice, very appreciative. You know, so far I really like working with them. All of them.
Right,
You know, they want to do their best.
right, right.
They really are.
Well, it's a big responsibility too with all the kids. I mean, that's a huge responsibility. So
I wouldn't want to be in his shoes, honestly.
I know it. I know it's very difficult for superintendents, principals alike. It's there are a lot of tough decisions to make. Yes, absolutely. But with the help of our medical people that we have, like yourself, you guide us through, and we need you. So very important. We thank you too.
So, Kristen,
Oh.
the flu discussion, should we discuss it now or later?
Yes, it's on the agenda, and we'll discuss it now. Next on the agenda is the flu clinic.
Yes.
So
It's a little bit tricky, especially this year. You know, we didn't do it for last couple of years because state stopped providing us with the vaccines. They want the town to purchase the vaccines, and it was like a little bit tricky and complicated, and they were not willing to, you know, support us and provide the vaccine like they did in the previous years. And I'm thinking this year it gets even more difficult because with this, I don't know how to do this, you know, like we have to be, have a huge team, you know, because I know state is willing to provide the vaccines for the children, but we still would have to purchase for adults.
I see. Are there any grants, federal grants or anything that we could know?
Using their money, and you know, like you make some money on it at the end, but it's, you know, like you have to deal with the insurances, send the papers to them. So I wonder, like, if I should even, you know, plan to do anything like this, or let this to handle for the professionals, because with the social distancing, with paper handling, there is so much or, you know, to prepare for it. And so the safety, because, you know, you have to give someone an injection, like they have to handle you a paper, you have to give them vaccine, but they have to sit for 15 minutes. You have to observe them. You know, town hall building is closed. We wouldn't be able to use for that. I'm just.
Yeah, I would say that with all that you have to deal with right now with COVID, I would leave the flu stuff to somebody else.
Yeah.
Especially if, like you say, the town hall's closed. They're not willing to provide them all. It's one of those things that just sounds like more trouble.
Would be a lot. Would be much more on our plate, you know. And if the things are like now, maybe, you know, I would be able to handle it. But if cases go up, it's going to be impossible.
Right. We'd probably rather you working less now with low cases and have you in the wings in case we needed you for some sort of an influx. That would be my take on it. And let people go to CVS or Walmart and get the flu shot somewhere else.
Yes, another thing is now a flu shot is required for school kids to enter school, but they have time till December 31st. Right. So they still have time to set up appointments with the pediatricians and see their doctors and, you know, plan for that.
Right. Now, previous years, would you have like a pretty solid group of regular people that would come to you for a flu shot, or was this something that was?
You know, we did have some, like, some people coming. Don't remember exactly the numbers. Yeah, it was pretty good, but we didn't have it last year, and I think those people got their shots, you know.
That was my question. Are like people dependent on you for this service? Because if they're not, then I would say let's not worry about it this year.
No, because there were like 2 years we didn't do it. A couple of years since they didn't provide the vaccines, and the people were able to get the vaccine somewhere else. And we know everybody's doing them now, like all pharmacies, Walmart.
Yeah,
you can get them anywhere. And
I would think that that's a very small percentage of people that absolutely have to go to you to get the flu shot.
No,
Yeah.
You know, like you say, most people are, there's so many places that facilitate that, you know, really, it seems to me that that shouldn't be a problem,
mhm.
you know. I mean, you would know best, but.
No, I don't feel like they depend on me.
Mm-hmm.
I think, you know, they will. We got some phone calls where people were asking about it, but we were directing them to CVS's or to Walmart, and people were willing to go there.
Yeah.
Agnieszka, I do want to say, I know like in Watertown, they are doing a drive-through flu clinic, and the MRC is assisting in that with nurses.
Mhm.
And then I believe the public health nurse is like helping with the schools to get the vaccines out. And again, like I think it's a big support too from the school nurses,
Mhm.
because I wasn't sure what the state put out, like what the town had to do.
Now, I did talk to the nurses, and I know they have so much now. Our school nurses,
Mhm.
we are opening the schools. You know, we're gonna be having kids at school. So I think, you know, adding more to their plate, I don't think it's a good idea.
Yeah.
Actually, Emily, you're gaining knowledge working where you are now in Watertown.
Mhm.
How did they fare over there?
How are they doing? Yeah, so they're pretty good too. I think they're white or green for cases, but yeah, so they're gonna do several flu clinics. The other thing too, I was gonna say, if anybody maybe just for people who have mobility issues, you could go to their house to do the flu shot, and that could kind of be it.
Oh.
Because I know that that's what their public health nurse does also.
But you know, we will have to purchase the vaccines. The provide for me. So, you know, question like how many do we need?
Right.
Yeah.
So maybe if we could always post something and then see if there is a need, then we would know.
Sure.
You know, just because of the fact that there still is COVID, and then if somebody has a mobility issue, for them to get to CVS or Walmart or something like that, Target, you know, could be difficult for them.
Yeah, but you know, on the other hand, I want to go to people's houses when it's COVID. You know, I don't know whose house I'm entering. I cannot wear full PPE to go to someone's house.
Mm-hmm.
I wanted to do this, you know.
Sure.
Get it else and give it to them. You know, unless is this a good idea?
No.
Many times those who have mobility problems have some services, I believe, you know.
Yeah.
Right. You got to be careful going into people's houses. It's definitely it could be an issue. You really have to make sure that the conditions are right before you enter. You're right, and then you need protective gear and everything.
I would need like, you know.
Yeah.
Worth it, you know? Is this worth it? And do I have really time for that?
Right.
You know, and like I'm the only one. There is no full-time agent who would be able to help me with some stuff, you know.
Right.
Some towns have nurse, but they also have a full-time health agent who is helping.
Yeah, I wasn't sure though if like the MRC, if that is something they could even assist on.
You know, even if I have an MRC, I still have to coordinate.
Right. True.
And organize, because we had some help with, you know, with the clinic, the day of the clinic, but all the preparation was on me and Kristen in the past. And I remember, you know, we didn't have COVID, and it was really a lot.
Yeah.
Mm-hmm. Okay. Anything else to add to that? Okay. Well, the next on the agenda is the health agent, and I think unless you have something else, Agnieszka, I think you covered it pretty well.
No, I'm good. Thank you. Oh.
You were all set.
Emily, how about you? Anything new?
What's that?
We haven't covered.
Yeah, I asked Emily if there was anything new.
Nope.
Are you asking Emily?
Yeah, there's nothing too new that we haven't already covered.
Right. Okay, so we'll move to the minutes. Can we approve the minutes of the meeting? I
No.
haven't seen the minutes.
No. Next time.
Next time, okay. Okay, so we'll move to Corey, reappointment, Corey's reappointment. We shouldn't be a problem tomorrow, right, Corey?
I don't think so.
You don't know?
We'll find out tomorrow at
We'll
7.
find out tomorrow. I don't think it's gonna be a big issue.
I'm glad
There was somebody else on the meeting last week that was interested in a position. So there may be a small discussion. We'll see. You know, I think it'll be up to the selectmen at the meeting tomorrow to make the decision, but
I think it's gonna go no problem.
Are you
Otherwise,
for reappointment?
otherwise we'll be holding protests.
what's that, Emily? What'd you say?
I said, is your term up?
Yeah.
Yeah.
So this is reappointment.
Right. Okay, do we have any other discussion?
Just a couple of things, Bob. Earlier this
Okay.
year, we talked about pumping the septic tank at the transfer station.
Pumping it?
Yes, it hasn't.
Okay,
And nobody remembers it being pumped, ever.
ever, yeah.
So I think we should do it before the ground freezes this winter.
Okay, well, we can have somebody go in and check it out, I'm sure,
Yeah.
and see, you know, of course, I mean, there's no point in opening it up if you're not gonna pump it, so we
It doesn't
probably
do
most
much. I
likely.
mean, that's why it's never been pumped, because it doesn't do a lot. You know, I mean, it's not a
No,
heavily,
it doesn't. It doesn't.
and if it has a leach field, it's probably, 95% of what goes in there is fluid anyway, so it's,
Right, it's probably not really necessary because it takes in the waste from one toilet and one sink, basically.
Right.
And it's almost
It's got a
nothing.
great little ecosystem going on in there right now.
Yeah, right, exactly. We have anaerobic bacteria working hard.
I would wonder if there's even a problem with it. I would wonder if you pump it,
Yeah.
you're going to pump out all the bacteria. Then you're starting all over again. Is that going to create problems?
Sometimes you're better off to leave the bacteria alone.
Are we going to create more problems by pumping it, or is that a problem that we fix if it breaks, or we be proactive? I mean, the system is 30 years old now, right?
Yeah,
Right.
yeah.
30-year-old system, never been pumped. As long as we
That's a
remember.
good question to ask an engineer. But I personally, from my experience, I would say leave it alone. That's what I would say, but that's only my opinion.
Could we ask Steve just for his?
Yeah, it wouldn't be a bad idea to talk to Steve about it, sure. Yeah.
And who?
Not a bad idea. Is
As
there
a
anything?
plumber, I would, as a
Corey or
plumber,
Bob, you gonna do that?
What's that?
Corey or
I
Bob?
can speak to Steve.
Okay.
I'm sorry, where are we going here? Where are we going?
We just
Okay,
finished.
Dick?
We finished.
all right.
I'm
Hey,
sorry.
Dick, how'd the clovers come out?
Say again?
How'd the clovers come out on the hill?
Good
The
question.
tomatoes are great.
I haven't looked in a long time. I need to go there and look.
No,
We
the
put it
tomatoes are great.
The tomatoes, yeah, that's the other side. I will go up. Now that you bring that up, we put it in just before that horrid heat spell, and I don't think some of it germinated.
Yeah, that was a tough one. I mean, I went up there a week or two ago too, and I just forgot to notice. I thought of it as I was driving back home, and
Yeah.
Hey, if anything, it was a good effort.
yeah, I thought that was going to be a good idea. I thought that would be a good little cover.
Yeah.
I'll
Well,
put some, I have a little bit of seed left and I'll put it in.
Yeah,
Is
now's the time. October's a great growing month.
Yeah, good
Yeah,
time right
yeah.
now.
yep.
September, October.
Now, second item, sooner or later, we're going to have to do a hauler contract.
Yes.
And
Oh,
George,
yes, definitely.
George and Dick and I have talked about some efficiency improvements up there. And I would like permission to, with a team of George and Dick, and we'll talk with the other guys, come up with some ways of improving the efficiency and bring it back to the board for their action.
Okay, well, what kind of upgrades are you looking at?
Open right now, but I know, you know, the two-part gate that opens up to let the hauler in?
Yes.
The chain on that is extremely awkward to put back.
Yeah, yeah.
And I have a very simple solution to that that is equally effective, but easier on everybody trying to put the chain back through the damn hole. Excuse the French.
Hey, I'm French. Watch that.
Excuse the Irish. So sometime, Bob, if you're up there and I'm up there, I'll show you what we're talking about for that one. George and Dick and I talked about that one. That one's relatively easy to do.
Yeah.
It would actually save, I think, a lot of time. Right now, the hauler is leaving the gate open when they leave it.
Uh-huh.
Because it is so difficult to put the chain back through the second gate.
Sure. Yeah, that's
but it's
something that
simple things like that.
Sure, sure. About. That's fine. If you want to, you know, go ahead and pursue that, that's fine with me.
Okay.
Any improvements are okay by me.
Yeah, so what we'll do is we'll bring it back in a week or so. Next meeting, how's that?
Okay.
Sounds good.
Non-emergency meeting.
Kristen, as far as contracts go, when is the we got an extension this year, but how long before we have to worry about another contract for there?
So they have till the end of the year. No, it's 1 year, so June 30th.
We got a 1 year extension?
Right.
Yep.
Yeah.
But we do have to do monitor wells because that did expire.
We should.
But
yeah. What we should do is probably at one of the meetings soon, gather whatever information we have about the last contract and see if we can start putting something together.
I'm trying to get a price about hiring like a consultant.
Well, do we really need to hire a consultant to do this? I mean, what we were doing, and it's working.
With the wells?
I'm sorry?
With the wells?
I thought you were talking about the
monitor
transfer
wells.
station.
No, that's fine.
Oh, the wells. I agree with you on the wells. Yes. Yeah, I agree with you on that.
I'm trying to. I'm getting help. So
yeah.
Yeah. But yeah, we gotta do that.
Okay, so we have two things that have to be addressed here.
Yeah.
We have the wells.
The wells first.
That's first, right? And then after we address that, we'll have to deal with the contract for the transfer station.
Yeah.
When's the wells up? Is that up now? Do we have to do that right away?
It's up, but the first testing of the new contract will be December, so we have to do something pretty quick.
We have to put it in there for anybody, or can we just?
Well,
refresh my memory.
Well, right now we just have pretty much a lab that goes out and tests it, and then we just get a result. But I don't know how well that's really working. What other towns do is they hire a consultant that oversees everything. So they have the lab go out, they test it. He analyzes everything, writes a report, sends it to the state, lets us know if anything needs to be done, how to do it. Rather than just what.
Now there's only X amount of dollars that we have to work with, correct?
Right.
Yeah. Do we have a budget for that item? I'm sure.
Yeah, this would be way over that.
Right.
So we'd have to.
We have to
go for more money.
Well, it is, yeah. I
But
mean, the
I-
way we did it, see, the problem is the way we did it before probably wasn't the correct way, but I felt like, again, maybe we should have left well enough alone because now we're faced with having to deal with it, but maybe not. You know, maybe it could have been a bigger problem down the road too. So
Never know.
it's bottom line is we have to deal with it,
Yeah.
and you know that's
So is
it.
the town gonna give us more money next year? I mean, this year's budget is done, but okay.
I asked about it, but I just need to get a couple different quotes. But I don't really know what to ask for because I don't know how to write these quotes. So I'm getting help. So we should be able to, I'll see if we can get something put together and then.
All right, so
Let you
next
guys-
meeting will be September meeting. So we only have 3 more meetings until they really need to be tested, right?
Right.
So we gotta.
Or we can just go along with what we have for another year. I don't know.
Yeah,
you know?
we might have to do that. We might have to do that.
Well, we might have to do that at least until fiscal year, so we can be allotted some more money for it. But
Yeah,
like
because right now we're in a bind right now. It's
yeah,
not,
how much money we're looking at? Can we use the enterprise fund to help pay for that, or no? We got to use.
No, we cannot do that.
So it has to come out of our current budget.
Has to come out of the Monitor Wells budget.
Which is not enough.
Well,
It's teeny tiny. All right.
yeah. So, but I will. I'll talk to you about everyone. I'll just decide. I mean, if you want to just continue for a year until we, like you said, can get money and get more information.
We can only do what we can do.
Yeah.
I think if we did see some quotes though, and just see, it
An
doesn't
idea, right?
wait, you know.
Right.
It'd be nice to know what we're looking at as far as the differential versus, current costs versus the consultant cost.
It's probably.
We have a pretty good idea.
It's probably it's quite a bit more.
Yeah. What's it? What does it come to more?
I'm trying to think.
Like, was it
double? Probably double.
Double. Yeah. So it was like 20,000, or is that right?
I think it was. This is just a rough, 20,000.
Right.
Wow.
Because Bruce Haskell, who does all our inspections, does this service.
Right.
He does it for multiple towns. And I did talk to him about it, but we need other quotes to see where he's at as far as pricing.
Right, okay.
But he meets all the state requirements, right?
He knows exactly what he's doing. Yeah.
And currently, what are we doing? So currently, we're just using
like a company that just does the testing and submits a report.
So the lab sends a guy out themselves, or
right now they give us a written report.
Yeah, so they send someone out, collect the water, send it to a lab, get a report, and then we get the report.
Right.
But why isn't that good enough anymore? Do we know why? We have to do something different?
Well,
we're not really like I don't know if any of us really know how to read the reports and really see.
The report means nothing to us.
We look at it like, oh, this one up, oh, this one down,
Right. We just compare it to previous reports, whereas this guy will know exactly what he's looking at.
Even if we compare it to previous reports, we don't know what the reports mean. That's the problem.
Bob, you're kind of like the test subject. You're downwind, and
yeah, I am the test subject. I am.
You're pretty good so far. So
everything's leaching to my property. Yes.
Right. How the ducks doing? Are they still good? So
they're okay. They're safe.
All right, then I think we're good. Pass the duck test. Good.
You'll have to get me one of those shirts, though. I love it.
Quick question, Kristen, were you ever able to complete the FOIA?
For Vivian?
Yes.
I asked for an extension and Dick and I are working on it. It's a lot of work.
Okay.
I told her that though.
Okay.
And I had to come up with a price and hours and how long it takes. And I just sent her that and she okayed it.
Okay.
So for this well thing, we really like as Board of Health, we can't really take that amount of money from anywhere else. So we
have to ask for it.
Yeah, we really need them to allot us that much more for that specific purpose.
I have to grab a charger. I'll be right back.
No problem. I mean that's a big ask.
Yes, it is.
From a small town, that's a big ask.
Yeah, that's why we're gonna probably. That's exactly why we're gonna bump it off till next year. We cannot do it. We can't.
No, I mean definitely not this fiscal year. Guys, out! Come on, go. Those dogs, they can't decide where they want to be. Yeah, so we're gonna have. Hey, man, that's a lot of money. That's a lot of money. And the town's got to find it somewhere, right? I mean, if that's something that now, if the state,
they're gonna have to, but we're gonna have to go with
a good enough job. You got to do a better job. Then the town has to effectively give us the money to do a better job of it. Otherwise,
right.
I mean, does that mean we have to raise prices at the transfer station, or
that has nothing to do with it? No, because that will only go to the enterprise fund.
Right.
Okay.
That's
kind of weird the way that works, and then you can't use that money anyways to pay for the stuff. So it's
very weird because it should come out of another fund, not our fund. To me,
we don't have don't have that. We don't have any more funds.
No, we don't have any more funds. That's the problem, and it isn't fun.
No.
We need somebody to donate.
That's pretty neat. You have a dog that opens the door.
Yeah, they just can't decide where to go. They all do. They know how to open doors everywhere. It's wicked annoying.
So I guess we're going to bump it off until probably the next meeting. We can probably get that onto the agenda, and maybe we can start looking into that.
Yeah, I'll start on that.
And like we said, we're not going to be able to afford it until next fiscal year, assuming that they give us something. But we need to approach probably the selectmen or the finance committee with.
I would like to recommend that we meet, like you said, Corey, live and together rather than the Zoom meetings. These are okay, but I mean, it's. How does everybody else feel about that?
I think now's the time while we're kind of low, I mean, if cases bump up and all of a sudden we got 15 people in town, then maybe we go back to remote, but things are opening up. I think that we can social distance in the meeting room.
Right.
And be pretty safe. If you can wear a mask, if you feel uncomfortable or, I mean, I don't have a problem with that either. So
Right. Okay, anything else?
I have one thing. The landfill grass mowing. Is it? I had the guy that does it ask me if it's ready. I don't know. I haven't.
Oh, if it's ready to be cut?
He did it the very end of June.
Right.
He doesn't want to wait till it's too long.
I'll find out tomorrow. I'll have an answer for you tomorrow.
Okay.
Okay.
Yep. And then one more thing is we have to start thinking about tire day too.
Oh, yes. Yeah. Okay. So
usually
that's usually in October, right?
End of October, beginning of November. Usually like the last. Yeah.
Right. So we can probably do that at the next meeting.
Yep.
Okay.
I'll get prices and everything before that.
Good.
Awesome.
Actually, I don't think I officially said that I gave my resignation for health agent.
Oh, that's right.
Nope, I didn't hear that. If I just ignore it, does that mean it's not not real?
Yeah, we just ignore it.
We'll post it.
Well, we're certainly happy for you that you have that job, and it's a wonderful thing, and I'm glad for you. But we're gonna miss you.
I know.
As agent. You did a great job as agent. We hope you're going to stay on the board, though.
Yeah, I'm definitely gonna plan to. And I'll definitely be there too for whoever we hire to help transition them.
Help train the new person.
That's
Yeah.
great. That's great.
Good.
But they
Okay,
they have
Emily,
a
thank you.
plan for like weekends too. So I was like, this isn't really gonna work out too well.
Yeah.
That's a lot. It is a lot. Health agent takes a lot of time, and now that you've got that other gig, it's
Yeah,
very
it
interesting.
is. Well, the
Yeah.
traveling and everything else going out to Watertown is not easy, but
No, and I
she's
definitely
probably
hope
learning.
that, like next
You're
fiscal
probably
year, I think it'd be good too if we could hire somebody who's full time, even if they were part-time health agent, part-time helping Kristen.
sure that would be good. Okay, are we
Big
ready
ask.
to adjourn? Do I
Next
have
meeting?
a motion?
Next meeting?
Oh, next meeting, yes. Thank you. What is good? Calendar? Kristen, can you help us
Anybody
here?
got a calendar?
Yeah, I'm looking.
Okay.
Your calendar.
Um,
Want to go like 28th, 21st?
They're all good to me.
28th,
28th?
is
Yeah.
that good?
He's
Okay.
fine with me.
Yep.
It's not like Yom Kippur or anything.
It is, it's something.
I start my new job on the 29th, so.
Not that I'm okay.
I
You
start
do.
my new job, Corey.
What are you doing, Bob?
I'll be teaching nights at Minuteman Tech.
Come on, really?
Yeah.
What
Adult
are you
education.
doing? You just can't quit? You just.
It's adult education, though. It's not, high school, so.
Hey, it's your wheelhouse, but boy.
Huh?
I said that's definitely your wheelhouse, but boy.
Oh, yeah. I mean, it's all code, so it's
Why
going
don't
to
you
be
take
great.
more than a couple months off,
Well, we just had a couple months off here.
Yeah, I get, yeah. You're already bored is what happened, huh? You're getting bored?
Exactly. I want to get back into the swing of things.
Oh, boy.
Okay, so do we have a motion to adjourn? Oh, no, I'm sorry. It is the 28th, right, Kristen?
Yes, no,
Okay.
Are we gonna try to do the next one in person?
yes.
Yes.
Is that okay,
How do you
Dick?
feel? How do you feel about that, Dick?
Fine.
You're all right with that? Okay.
Oh, absolutely, yes.
Does anybody
Okay.
have an objection to doing that? Emily, Amanda?
No, that's totally fine with me.
Okay, great.
I have one more thing, actually.
Yeah.
Agnieszka has been using her private cell phone.
Oh, yes, yeah.
And so we talked about maybe getting her a phone and service, just because she shouldn't be using her own, because people are calling her back and texting her and.
No.
Well, that's why we can't test the wells. Because
we need to get, thank you.
We have a lot of ideas, don't we?
So I forget the price. Do you remember the price?
No.
I don't have it in front of me. But it will be the phone and the service. So the service I think is $40 a month, maybe.
Yeah. That's fine. That's fine.
30 or 40 a month.
I think we can start saving bottles at the transfer station. Pay for it.
Fans.
We probably could.
I'm
So is that
only kidding.
okay?
I'm only kidding.
Is that okay with everybody that we get our phone?
That's great. I think it's
Wonderful idea.
Yeah.
Yep, I think we need. I wouldn't want to use my personal phone to call.
No, she shouldn't be.
Right.
And no one even thought of that. So
I know. You don't think about it until you're
Yeah.
involved.
So you're the one calling, right?
Right.
all right, good.
Yeah. So
Anything she wants, she gets. Period.
how's that chair you're sitting in? Is that you got a good office chair in there?
Is it computer fast enough?
Brag about it. Laptop from the state for free.
Ooh.
For free.
I'm using my personal one for all work.
There you go. There you go. Yeah. Well, like I say, Agnieszka, anything you want, you get, period.
What's calling me here, guys? Thank you.
Okay. Okay. Are we ready to adjourn here?
I'll make a
Do we have a
motion.
motion?
So made.
Second.
Okay. Second. All in favor?
Aye.
Aye.
Okay,
Aye.
meeting adjourned.